As a family physician with a focused practice in sport and exercise medicine, many of my patients suffer from low back pain, and many of my clinician colleagues find it difficult to diagnose and a challenge to manage. The crux of the matter is that 90% of low back pain symptoms are not due to serious pathology and don't need investigations or surgical referrals. We need to find a better way to assess and manage low back pain. The majority of low back pain patients will benefit from lifestyle changes, which often lead to much better outcomes than more diagnostic tests. In 2012, Ontario launched the low back pain strategy, including the original version of the C.O.R.E tool. While primary care providers found the tool very useful in assessing patients, they also provided important feedback that allowed us to improve the flow of clinical decision-making and enrich the patient management content. Some of these improvements and enhancements include updated literature and guideline references, integration of the key patient messages into the flow of a typical visit, and color coding to ensure that red flags are not missed. This tool was developed through an engagement process that created an inventory of existing clinical tools and guidelines and presented them to primary care focus groups and clinical experts in order to determine the critical components of the clinically organized relevant examination, hence the acronym C.O.R.E. The C.O.R.E back tool has 5 major components that allow you to easily identify the 90% of patients with mechanical low back pain, while not missing red flags that may represent serious pathology or yellow flags that may indicate an increased risk of developing chronic pain. One of the key components of the revised C.O.R.E tool is a question that allows the clinician to really understand the impact of a patient's pain on their function. Ask your patients, is there anything that you cannot do now that you could do before your low back pain? This question can also be used in follow-up to monitor recovery and progress. Other features include aligning the history with the back pain patterns so that a clinician in just 3 questions can easily identify the correct mechanical pattern. Open-ended questions to help you identify yellow flags, and an enhanced management matrix so that you have much more pattern-specific treatment strategies. In closing, low back pain is here to stay. But for our patients, let's make it a short stay. Use the C.O.R.E tool, a patient-centered, clinician-driven tool for appropriate care, supported by evidence.